I'm Carrie Coen, and I'm Director of Summit Therapy and Health Services. One of the biggest things I think is the time that we can save in things like traveling to and from homes, to and from school districts, even taking patients from the waiting room back to the treatment area. If we can save even that little bit of time, that allows our speech and language therapists to have time to add to the service, to do documentation, and to do things that are much more productive.
I've really enjoyed the teletherapy model because it has broken down some of the barriers that we might face as a practitioner or as a patient.
Currently, right now, we're working with the Pullman School District, and within that, I am working with 2 speech therapists, and it will branch over 3 schools this year, which is an increase from last year. It's kind of exciting to experience working with more than 1 school, and so we'll have the opportunity to work with grade schools as well as a high school this year.
Our biggest partner is Gemini Systems out of Spokane, Washington. Brian and Laura Kasbar, who are the founders of that company, have known us for several years, and we've been working with them to develop our speech and language platform.
We would like to increase the scope of our practices, possibly with school districts that are in areas of the state in which they have difficulty hiring a speech therapist.
Most kids are very technological these days, and they seem to really light up when they're invited to use technology in this way. Not only can we see children in their homes, but we can follow them around their natural environments, whatever environment that is, be it daycare, schools. We have a feeding and growth team right now, and we're trying to evaluate a child's ability to eat in their family setting. What better way to do that than to be like a virtual family member?
In terms of patient privacy, I'm not worried at all. The video system that we're using, the platform it's not terribly expensive per month, but it does have very high quality HIPAA standards already built into it. In looking beyond that, there's a huge variety of applications that we can use here in our department, including exclusively using it for genetic counseling as well as health psychology. And in addition to that, there's applications that can be partially used for occupational therapy, physical therapy, and audiology. It really is going to be, I think, something that is groundbreaking in terms of what speech and language therapy is going to look like, not only here in our country, but all over the world.